Hello everyone, I'm Dr. Gaurav Gupta. I'm a liver transplant and HPB surgeon at Fortis Hospital, Mumbai. I'm a liver transplant surgeon and my transplant journey started close to 10 to 15 years ago. I've been trained at UPMC at University of Pittsburgh and Philadelphia in the USA. UPMC is one of the biggest liver transplant center in the world, and it is the center where the transplant actually developed in the whole world by Dr. Thomas Tarzer, who is considered to be the father of the transplant. I was lucky to be trained under Dr. Abhi Humar, and after that I did my fellowship from UPenn, Philadelphia, under Dr. Abhi, who is again one of the most renowned transplant surgeons in the world. After finishing my transplant fellowships and doing other research fellowships, I've been in India now for close to 4 years doing transplants. I have an experience of close to performing more than 500 liver transplants as a primary surgeon. The kind of the surgery which I perform is both cadaver liver transplant, living donor liver transplants, swap liver transplants, and ABO incompatible liver transplants. Today we're going to talk about one of the common disease which is called liver cirrhosis, which is the most common indication for liver transplant. So first of all, we need to understand what is liver cirrhosis. So liver cirrhosis is nothing. It is culmination of various diseases. So it can be hepatitis B, it can be hepatitis C, it can be alcohol, or it can be simple like diabetes, hypertension, which is commonly called NASH or non-alcoholic state of hepatitis. So all these disease, what it causes to the liver is, it causes inflammation to the liver. Now if this inflammation goes unnoticed, gradually this inflammation will progress to a chronic disease or a permanent liver damage, which includes liver fibrosis, and this condition is called liver cirrhosis. So what happens in cirrhosis is the normal liver becomes smaller in size, it becomes hard in ecotexture, and liver becomes very irregular in surface. The normal liver surface is very smooth and its edges are very sharp. But in a cirrhotic liver, it is a bumpy liver or a nodular liver, and edges are rounded and sizes become small. So this is what is called liver cirrhosis. Now, once liver cirrhosis sets in, all these patients will behave like this. It is immaterial whether it is because of what is the etiology of cirrhosis. All these patients will behave like that. And what are the common symptoms which will you observe for diagnosing of liver cirrhosis? So the common symptoms are like as simple as water in your belly, or what we call ascites. It can be bleeding from the mouth, what called upper GI hemorrhage, or from bleeding from your stools, where your stools will become black, charry, which we call melena. Other common symptoms or signs of liver cirrhosis can be kidney injury. It can be high ammonia level in your blood, which can cause hepatic encephalopathy. Other things which liver cirrhosis can cause is our blood becomes very thin, and the thin means it becomes coagulopathic. So someone who sustains any bleeding, our blood automatically clots. So because if the liver is damaged, all the factors which helps in clotting of the blood, those factors are gone. So the bleeding won't stop. So patient will have a lot of continuous bleeding. So this is called coagulopathy. So all these symptoms can present in liver cirrhotic patients. Not everyone have all symptoms. Some of the patient have one symptom, some have other symptoms. It doesn't have to be all the symptoms in the one patient. Now, what is the treatment of the cirrhosis? Now, unfortunately, we have very limited medications which can treat or which can at least control the symptoms of cirrhosis. So we have very limited medications. And whatever the medications are available, these will be work only for temporary time. It won't be a permanent solution. All these measures are what I call band-aids. So it's not gonna cure the problem. It's just gonna buy you some time. The permanent cure, or what I call is a therapeutic options in liver cirrhotic patients, remains only one. It is called liver transplant. So basically, what is liver transplant? And liver transplant will take that cirrhotic liver out and put a new liver in. So that is called liver transplant. Now, transplants can be broadly divided into two. One is called cadaver liver transplant, another is called living donor liver transplant. In cadaver liver transplant, if there is someone who has sustained an injury or sustained a road traffic accident, if someone becomes brain dead and their relatives agrees to donate the liver, then we take the liver and put that into the someone who needs a liver transplant. But unfortunately, the cadaver donations are very small in number and limited. So to overcome that problem, we have what we call living donor liver transplant. Now, living donor liver transplant is a surgery where someone from the family, who can be brother, sister, father, mother, son, daughter, relatives, blood relatives, they donate a part of the liver. We take a part of the liver from those patients and transplant into someone who needs a transplant. Now, a common question which has been asked to me is, what will happen to the donor? Because we'll take a part of the liver. Now, the thing is, liver is such a wonderful organ in our body. It is the only organ in the body which will regenerate. So it is the only organ where if you take a part of the liver, the rest of the liver will grow back. It does not happen with the kidney, it doesn't happen with the heart, it doesn't happen with the lungs. Only organ which can happen is liver. So, and it grows very fast. So even if you take half of your liver, it grows back to 90% within 6 weeks. And it grows back to almost 100% in 3 months. So that is the reason that even if you take a part of the liver from a donor, the donor will live a normal life. It won't have any problem, the liver will regenerate and they just live a normal life. So this is called living donor liver transplant. So here, only thing which we need to do is only blood group matching. Like in kidney transplant, we have to do HLA matching, a lot of DNA matching. In liver transplant, we just have to do blood group matching and simple blood test for the donor, and then we can go ahead proceed with the liver transplant surgery. On an average, liver transplant patients, our patients stays in the ICU for 1 to 2 days after transplants, and they generally go home in 7 to 10 days after transplant. And transplant not only increases your lifespan, it changes the quality of life, it improves the quality of life. So very clearly there is no doubt about it, liver transplant is a wonderful treatment for the patient who are cirrhotics, who have chronic liver disease. Now, important thing to realize is transplant, after all, is not like any other surgery. It's just not like any general surgery. Having been trained at some of the best centers across the world, I realized very early in my career the importance of multidisciplinary approach and the importance of latest technology in treating these patients. And that's what we have tried to replicate here at Fortis Mulund. We have a dedicated transplant unit which is manned by the transplant intensivist, our team comprises of transplant surgeons, transplant anesthetists, ICUs, intensivists, dietitians, physiotherapists. So it's a whole team approach. The surgeons just cannot do anything alone. It has to be a team approach. That's the only way we can give a quality and a good outcome to these patients. So in a multidisciplinary approach, in a dedicated settings, transplant gives excellent results. The transplant survival we generally measure by 30-day survival and 1-year survival, 5-year survivals, and 10-year survivals. So 30-day survival at our institute right now, I'm pleased to say is at 100%. So none of our patients have a surgical mortality. So I'm pleased to tell that. 1-year survival is close to 90%, which is comparable to the best in the world. We don't have a data for 5 years or 10 years survival. as of now. But I'm sure even 5-year, 10-year survival will be pretty close to the worldwide average. Now, to conclude, I just want to tell everyone that these chronic liver disease patients, liver cirrhosis patients, they just need not be afraid. There is a hope for them. There is a light at the end of the tunnel. And getting a transplant can give them great quality of life, and they can increase their lifespan, and they can live life just like any other normal person.